I'm in front of CIMA Hospital in Costa Rica, which is the main private hospital in the country. And I am here today to pay out of pocket for medical care. So I thought I would walk you through the process of why I'm here, how I made an appointment, how much it costs for all of the procedures, and what the outcome is since we're here in Costa Rica. And if we haven't met before, my name is Kristin, also known as Traveling with Kristin. I've spent 8 years living in Costa Rica, and since then I've been traveling around the world helping people move to other countries through my relocation company. So if you want more information about that, I will link to my website below. So why am I here? What is wrong with my health right now? Well, I've made 2 appointments, one for today and one for tomorrow, to get 2 opinions, as you do, with different specialists that I'm hoping can give me some answers as to what I've been experiencing. Well, it all started about a year ago now, after a period of really heavy travel, where I started experiencing some strange numbness in my left leg. You know, when you Google things, it looks usually a lot worse than it is. Google and ChatGPT doesn't always give you the right answer. But from what I could tell, it might be something with a disc in my back. It could be a lot of different things. I don't really want to speculate, but I guess we'll find out today, hopefully. It wasn't happening frequently enough that I felt like I needed to go to the doctor. I thought, okay, maybe I've been sitting at my desk for too long. Maybe I've been sitting in planes too often. So I thought with a combination of physical therapy, yoga, stretching, Pilates, I got a standing desk, I got a treadmill to go under my desk. I thought with all of those things that I could heal whatever the issue was. But over time, it would kind of come and go. And then recently, in about the last few weeks or the last month, it's gotten a lot worse, where it's even affecting my left foot. I'm feeling numbness on the pad of my foot, which is super scary. I didn't have time in the US before this trip. So I went to the CIMA hospital website. I contacted all of the neurologists and spine surgeons, anyone like that. Some people were full or it didn't show any availability. So I just sent them an email or oftentimes a text message on WhatsApp, and I was able to get in for 2 appointments back to back. So I'm gonna go to the first one now and see what their opinion is and what kind of tests I'll have, how much it will cost, and then I'll go to the next one tomorrow. And it's kind of interesting because my mom is also here getting dental work done, and I also went in and got a checkup yesterday. So I'll also show you later in this video what that dental office looks like and how much it costs to get cleaning, x-rays, consultation. They do incredible x-rays, these like panoramic 3D x-rays that cost like $800 or $1,000 to get in the US. So you've got to see that. It's super cool. Founded more than 25 years ago, CIMA Hospital is the best private hospital in the region, offering comprehensive medical care with more than 60 specialties. They also have a lifestyle center, which is a preventative medicine area offering checkups, lab tests, imaging diagnostics, specialized exams, and more. Okay, just finished in the doctor's office and it cost 70,000 colones, so about $140 for the appointment. He said I have myalgia paresthetica, which is one of the things that came up in my Google search, but he said that it's not serious. It's just uncomfortable and annoying, but it's not like a grave danger that I could be paralyzed or something like that. So he said it's from a compressed nerve in my hip, likely from airplane seat and having the seatbelt on too tight, or like the position I was sitting in, and that it can just go away with time as long as I avoid compressing the nerve more. So in this case, I didn't have to get any kind of tests or other treatments, and I don't have to come back. He said there's like medicines and things that you can take, but it's not recommended because those have side effects. As far as the wait, I only had to wait 15 minutes because there was another patient ahead of me and he was like apologizing, but I felt like the appointment was really thorough. He took his time. It wasn't rushed, like that feeling that you get often in the US. And then he said I can always message them WhatsApp or email if I have any other questions. So now I'm gonna go back to the hotel and think about if I want to come back tomorrow for another opinion or if I'm good with this one. So we'll see. The next day, I met up with my mom for breakfast, which comes included with your package stay getting dental care here in Costa Rica. Welcome back to Costa Rica. I'm standing in front of the Dr. Munoz Cavallini dental office here in the center of San Jose. I've been here twice now with my mom, and I can say that there's a lot of happy customers around here saving tens of thousands of dollars on their dental procedures. So I don't have the exact price list, but I'll link to the website if you want to check it out if you've been looking to get dental care at a more affordable cost and also have a good time, hang out here at the Sky Cafe, stay in some of the nice hotels and apartments. This is not sponsored, but it's a place that I've become very fond of, having come here with my mom and also having gotten my own dental consultation during this visit. I didn't want to be left out, so I paid $250 for a dental cleaning, these panoramic x-rays that are insane, like the level of detail that you can see, and also a consultation by one of the dentists here. Perfectly a-okay on my report, but you never know. So I got a preventative checkup here. So yeah, let's see if we can go and take a look around and I'll show you inside. Dr. Marco's International Dental Clinic was founded in 1968.
Hola, ¿cómo están? Taking a video.
And it's really a place that feels like family. Hi.
Hey.
How are you?
How you doing?
Dr. Marco and his team have restored more than 58,000 dental implants and 100,000 crowns and bridges since 1980. Okay, I'm here with Dr. Marco.
Hello, how are you?
He's gonna show me x-rays of my teeth.
What I was talking about, this is a dental CT scan, and here you'll see different images of your oral cavity. So as you see, I'm moving the inspection window around the 2D image, you see?
Yeah.
This is the panoramic we just saw. Now here, as I move my inspection window, let's see, I'm gonna place it in tooth number 30, and I'm gonna show you how the other images work. This is a longitudinal, we're looking at like a side view, you see?
Yeah.
And if I magnify it, then we can look for important, just check on the condition of the tooth and other important structures, as I said. The cross-sectional, if you see this doll here, you see the different dolls?
Yeah.
This one, I am looking at you from back to front.
That's
As I
my
look
back of my head.
on the back of your head. And when I see you on the back of your head, based on this location, if we magnify it, we can see the tooth from side to side. And for example, if there is a lesion here in a 2D image, it wouldn't show because you only see the front. So we're able to see things on the back and see things on the sides that we wouldn't be able to see with other images.
How do my teeth look?
They look fine.
Oh, okay.
I'm very happy to report that to you. Your teeth are healthy and we want them to stay healthy. So as I move my inspection window from your right side, so you can see, here are your front teeth. This is an example of your front teeth. These are the incisors. And look at this. This is your chin. And here is a little piece of your nose. And this is the thickness of the bone. And here, you see, this is looking at you from top to bottom. These are the top of your bottom teeth. You can also see this reference here, you see?
This is what I'll look like in 500 years.
I think this is your opportunity to look at your own skeleton and being alive at the same time.
It is a very weird feeling, to be honest. I feel like I'm looking at a museum, like a mummy of myself, but I'm alive.
Thank God. You can see the shape of the teeth. It can help track canals, curvatures, and things for endodontics too. Here, this is the 3D image we were just mentioning. This is an image of your skull. It's not complete skull. It's only the area that applies to us. We use this to look at important anatomic landmarks, as I said, but it gives us all of these images. When you use them all together, they help you plan your treatments. one of the advantages we have here is that all of these equipments, the digital panoramic and the CT, we have them here in the building in our own office. You don't have to go anywhere else. And these are part of your treatments. They're included in the cost. You don't have to go and pay extra money somewhere else to get those images. Yeah. And we do plenty of them because, for example, for a procedure that we do a follow-up with these images to make sure that everything is going well. Yeah.
I'm really happy to have these images.
Sure.
And thank you for...
I can email you a viewer if you want. Not the full because it's very heavy, but I can email you a viewer so you can play with it.
And I just wanted to get it done because I've been here twice with my mom.
You've been with your mom, yeah.
I've seen everyone getting all of their dental work done, and I'm not saying I want to have dental work done, but I'm just saying I thought it was interesting.
Sure.
So what kind of procedures are like the most common things people come here for?
People come here for dental implants. That is one of the core treatments that we do. Patients come for full mouth reconstructions, either with crowns or natural teeth or with implants. They come also for cosmetics and, as I said, dental implants in general. So this type of imaging is critical and it's mandatory for implant placement.
Yeah. And we also get to have fun because now we're going to dinner with the whole dental.
We host a patient dinner every Wednesday night. We're going to the country club. It's a group of patients. Whoever wants to go, they'll go with me. Yeah. And we're going to have fun.
So we're going to go right now. If you need dental work in Costa Rica, come to Dr. Marco, not sponsored.
Yay.
Want to give it a try?
Good job.
After the dinner?
Hi guys, so as it turns out, it looks like I'm gonna miss my second doctor's appointment here in Costa Rica because it's rush hour. I've been in this bank too long and the last 3 Ubers I chose canceled on me. It also looks like there's 3 or 4 accidents on the way to the hospital, so it's probably gonna take me like 30 or 45 minutes to get there instead of 15 minutes. So I'm just gonna go ahead and skip this appointment, but that's okay. I can just get another appointment in the US and then compare what the diagnosis is there to what they told me here. You know, my mom was really impressed with the neurologist that I went to see yesterday. So I'm really curious about what the doctors in the US will say about my condition. Either way, I hope that this video gave you a lot of good information about how much it costs to pay out of pocket for medical care in Costa Rica. Make sure to subscribe if you're new and watch this video next to find out the best countries in the world for good healthcare.